I'm presenting on behalf of my team. Now, I'm not sure whether you will like my presentation or not, but I can guarantee you one thing, that you might leave a few minutes longer after attending my session. And it's a very cheap joke, don't worry. You won't leave longer after listening to my presentation, just a joke. Anyway, thank you very much. Thank you for attending this session. So my presentation has 4 parts. The first part, I shall introduce Avoidable Deaths Network's Avoidable Snakebite Deaths project. After that, I shall briefly describe about my research journey, because when I started this project, I have been asked several times by many people, why am I here? Why am I looking into snake bites? Because your background is very different. So I want to tell about myself, because I've never been to Venoms and Toxins conference before. I've never been in front of any of this learned society related to snakes and venom. So I'm brand new to this field. Then I shall share the findings from 3 states in India, which is Assam, Madhya Pradesh, and Orissa, and identify a few possibilities for improving policy and practice. Now, if there are any questions, Dr. Stephen and I would be very happy to take on at the end of my presentation. So the project was led by me in collaboration with 14 organizations, and we also had 11 gatekeepers. The project duration was 7 months. It was a very small scale scoping project. It was funded by University of Leicester's Institute for Advanced Studies and Institute for Environmental Futures. It started with a seed fund from Leicester University, but also we received lots of in-kind support from OFIREX, PR Connect, both are based in the United States, and Orissa State Volunteers Social Workers Association, which is based in Orissa, and Orissa State Volunteers Social Workers Association also hosts the ADN India Hub in Bhubaneswar. So this is the project a little bit more. So we explored 4 research questions. Number 1, how can snakebite deaths that are avoidable, which I call it avoidable snakebite deaths, be reduced during disasters? Number 2, who is responsible for reducing snakebite deaths? Number 3, how can we engage with these key stakeholders who are responsible? And finally, how can we engage with the high-risk groups who carry the burden of snakebite deaths at the village level? So we used qualitative methods such as stakeholder mapping, interviews, focus group discussion, consultations, symposium, 2-day symposium where we had about more than 28 technical experts from around the world. And we also arranged a high-level roundtable meeting in New Delhi to disseminate our research findings. So these different methods were being used to corroborate and increase the validity of our qualitative data. We collected data from 3 states, Assam, Orissa, and Madhya Pradesh, and we chose them due to Avoidable Deaths Network's pre-existing connections. And as I mentioned, that ADN India Hub is based in Orissa, so Orissa was an easy choice for us, but also these states carry the high burden of snake bites in India, with the exception of Assam. And we gathered our data from January to June this year, so we literally collected the data a couple of months ago. Our framework was informed by our snake bites, which is our avoidable deaths framework, which comes under the ambit of disaster risk reduction framework and public health and systems thinking. I'll talk about these approaches shortly. Now, before that, I would like to tell you briefly about my research journey and how did I get into this avoidable snakebite deaths project. This is largely to do with my obsession, absolute obsession about how can we reduce disaster deaths. And I got into the field of disaster risk reduction in 1999. And I strongly believe that zero damage from disasters is impossible. It's impossible, but zero casualties from disasters is absolutely possible. With this firm belief, I think that we can reduce disaster deaths. And it all started in 1999. In 1999, I was a master's student doing my social work at the Institute of Tata Institute for Social Sciences in Mumbai. And on 28th October, Orissa, an eastern state of India, which sits on the coast of the Bay of Bengal, was hit by a tropical cyclone. It was category 4, and it killed more than 10,000 people. And I volunteered as a social worker. I went there. I spent some time with the state government in the district of Jagat Singhpur, which carried the largest burden of the disaster deaths from the cyclone. Now, that particular experience was instrumental in shaping my life, career, and skills. So in 2003, I returned to Orissa once again to conduct 9 months of fieldwork for my PhD research at the Department of Sociology. So basically, I'm a sociologist, and I did my PhD in sociology in the Department of Sociology at Warwick University. Since 2000, I have been obsessed in exploring research that is related to reducing disaster deaths. I kept bringing different types of questions to understand, for example, what happens to caste, class, and gender in multiple disasters so that we can improve disaster management policy in the state of Orissa. Why do people die in disasters? Who dies and who is responsible for reducing disaster deaths? I've also explored how to promote resilience in health systems so that women and girls' mortality from post-abortion complications can be reduced during disasters and humanitarian crises. I've also explored which disaster deaths are avoidable and are unavoidable, and how can we reduce them. These research projects have taken me to India, Bangladesh, Japan, and few other countries, and led to 2 research monographs: improving the quality of sexual and reproductive health services during disasters in Bangladesh, the launching of the Avoidable Deaths Network in 2019, and the global campaign this year, in which we declared 12th March as the International Awareness Day for Avoidable Deaths. We also call it IAD for AD, and introduced the slogan, "Disaster deaths are avoidable." You will see the graphic, which is right at the bottom of the slogan on my PowerPoint slides. And this graphic is downloadable if you visit our website. If you believe in reducing disaster deaths, please feel free to use it, advocate it. We'll be very grateful for that. The purpose of this global campaign is, number 1, to raise the visibility of avoidable disaster deaths, especially indirect disaster deaths such as snake bites, drowning, and missing persons. Second, to capture the causes and circumstances that lead to avoidable disaster deaths so that context-specific solutions or interventions can be put in place to save lives. The concept of avoidable disaster deaths comes from the domain of public health. The departure point for me is that I'm trying to bring this concept into the disaster risk reduction domain. The seminal work of public health experts on avoidable deaths include John Mansfield, a little-known general practitioner based in the United Kingdom, and he wrote a book in 1970 on avoidable deaths. Then we have the Preventable and Manageable Diseases Working Group led by David Rushton and his colleagues, starting from 1976 at Harvard University in a hospital setup. In a non-hospital setup, the seminal work on avoidable deaths stems from the Office of the National Statistics in the UK. Now, due to constraints of time, I shan't go into the details of these approaches. Now, the other approach that it comes from is the disaster risk reduction. And this is led by the Sendai Framework for Disaster Risk Reduction, which was revised and relaunched again in 2015 in alignment with the other international frameworks such as the Sustainable Development Goals, the Paris Protocol. Now, the Sendai Framework has set 7 global targets. And of these 7 global targets, the first 2 targets are relevant to my study. Number 1, which is target A, substantially reduced global disaster mortality by 2030. Target B is substantially reducing the number of people affected by disasters by 2030. Now, these 2 targets work at the interface with several sustainable development goals, such as number 3, 11, 13, and 17. Now, although the Sendai Framework does not talk about or mention about avoidable deaths, but we can understand its proximity to the words reduce global disaster mortality. The Sendai Framework's perspective focuses on stock taking and monitoring systems, defining terminologies such as direct, indirect, missing persons, indirect, immediate, indirect, delayed. So these are the definitions that the UNDRR came up with in 2005 and kept updating, and recently it was updated in 2020. In 2020, the UNDRR also recommended using causes and circumstances to start recording and reporting disaster deaths. Now, under these perspectives, in 2020, it became very clear that snake bites are considered as indirect disaster deaths. So I hope it gives a little bit of a context why I am here and why I'm here at the Venoms and Toxins Conference. So inspired by the Office of National Statistics in the UK's definition of avoidable deaths, avoidable disaster deaths are of two types. First, amenable death, and second is preventable death. Now, I have extended this definition to include disaster risk governance related death. Amenable deaths are deaths that could be avoided through timely and effective healthcare. And preventable deaths are those that can be avoided by public health interventions. And disaster risk governance related deaths are those that could be avoided through effective healthcare, public health interventions by different actors and organizations, and effective disaster risk management from district to sub-district to village level. So to reduce avoidable deaths, amenable measures, preventable measures, and disaster risk governance measures are proposed through the avoidable deaths framework. Also, understanding the context-specific causes and circumstances of amenable, preventable, and disaster risk governance-related death is vital to come up with context-specific interventions so that deaths could be reduced. Now, with this brief background on avoidable disaster deaths, I would like to introduce you to the scale of the problem with regards to snake bites in India. Very briefly, we know that India is the hotspot of snake bites. So more than 58,000 snake bites occur annually in India. 75% of deaths occur before reaching hospitals. A more recent study in India found that most snake bite deaths occur in rural areas, about 94%. And these deaths are taking place at home. And half of all deaths occurred from June to September during the monsoon season. Now, I was very pleased to see that Professor, the first speaker's presentation showed that the bites were between June and September. That's the data that I have is from 2020, so it is in a way consistent with what the first research team, the first speaker from the University of Reading found it. So this particular season, June to September, is the monsoon season. And this monsoon season is notorious for flooding in the South Asian subcontinent. This finding is also consistent with another study in Bangladesh, which found snakebite was the second largest cause of death in the 2007 floods. Even under lower emissions pathways within the Paris Climate Agreement, it is projected that nearly all Asian countries face an increase in the frequency of extreme river flows. This projection implicates snakes as they are connected to the environment. Extreme heat, extreme river flows are likely to increase human-snake exposure and encounters, leading to deaths. So the avoidable deaths approach provides a valuable pathway in this aspect to integrate into disaster risk management, health, human system to reduce human-snake conflict and save lives from floods or other hazards. Now, the 2023 monsoon season in India has had a huge impact. It flooded more than 15 Indian states. It led to 40 million people being displaced and more than 2,000 deaths. As part of the Avoidable Snakebite Deaths project, we have formed a WhatsApp group of more than 50 technical experts, and almost every day we have been receiving news related to snake bites and deaths. This slide captures 4 such stories. I'm not going to tell all these 4 stories, but on the extreme left, you would find that the Punjab State Minister of Education, Mr. Harjot Singh Bains, was bitten by a juvenile snake whilst visiting his flooded constituency. Mr. Bains is safe and sound, he tweeted. The second news article is in Bengali, right in the second, after the second middle bit, that a mom of 2 children, she was sleeping, this happened in Sundarbans, she was sleeping inside her mosquito net at 2 o'clock, all 3 of them were bitten. Mom, the daughter, and the child who was 6-year-old. The delay was a problem. The little kid who was 6-year-old died, the mother and the daughter survived. On the extreme right, you would see, it's absolutely interesting. This article was written in Oriya. They found that in the district of Balasore, in one day, 15 people were bitten and 3 people died. Now, this is just a small selection of samples of snake bite deaths that's going on at this at this moment in India. Now, these deaths are avoidable. That said, who is responsible for reducing them? Let me share some findings from our Avoidable Snakebite Deaths project. So we did stakeholder mapping at the national and international level, and we found 6 categories of stakeholders who are directly and indirectly involved in reducing snakebite deaths. This includes local communities, such as village-level health workers, traditional healers, snake handlers, and so on and so forth. Second is the healthcare professionals, which includes medical researchers, providers, creators of policy, guidelines, insurance. Anti-venom, venom, and snakebite. These are the people who extract and collect venom, produce anti-venom drugs, keep supplies available, research drugs, and delivery of improving effectiveness and availability. And we also found public awareness, such as educators, funders, promoting wider attention to snakebite envenoming as a public health crisis. Emergency services, the first responders in disaster situations who, in this case, help protect affected population from snake bites in cyclones and floods, or provide emergency ambulance services for snakebite victims. And finally, snake profilers, the persons who are basically knowledgeable about lessening snake-human interactions, such as herpetologists, specialists from agriculture, forestry, and animal welfare services, and traditional snake healers, who understand snake behaviors and the ecosystem they inhabit. So the amenable and preventable measures promoted by national and local authorities ought to engage with the stakeholders that we have identified. These stakeholders also need to be included into the disaster risk governance framework. Now, who is responsible for reducing snakebite deaths at a village level or a district level? So we identified 17 stakeholders at the district level, 1 at the sub-district level, and 9 at the village level. Now, I'm not going to read them all because of the constraint of time, but I'm going to give you a few shocking findings. Number 1, we found that primary healthcare facilities in our villages, 3 villages that we identified, are not designed to save lives from snake bites, so they do not have AVS. Second, a district emergency ambulance service was found to be running only in 1 village in the state of Assam. There were no ambulances in the state of Orissa and Madhya Pradesh. Now, these challenges and barriers have serious implications for the SDG 3.8, which is universal health coverage. These services need to be bolstered to strengthen the health system and reduce avoidable snakebite deaths. We also explored the feasibility of 2 networking models, which we call it knowledge exchange network, and the second is local level action network. We spoke with all our stakeholders and we found that there is an appetite for knowledge exchange network, which is CAN, and local level national action network, which is LEN. The CAN stakeholders cross-cut 9 sectors. We found 9 departments, for example, Orissa State Disaster Management Authority, Revenue and Disaster Management Department, Met Office, Forest Environment and Climate Change Department, Minorities and Backward Classes Welfare Department, Department of Housing and Urban Development, Agriculture and Farmers Empowerment Department, and also we thought another important department that we found that would play a key role in CAN is Department of School and Mass Education. Now, Avoidable Deaths Framework can provide much needed operational direction to CAN for unknown issues and spark context-specific actions to save lives. On the other hand, local level action network is designed for high-risk groups, such as Adivasi and Dalit farmers, children, women, and herders. On 19th September, which is the International Snakebite Awareness Day, we are going to launch a case station, first of its kind at a village level in Burujhari Ganjam district, which is the hotspot of snake bites in Orissa. The case station will be led by the high-risk groups and also led by the local authority. And these activities, we think that would directly contribute to SDGs targets, as well as the World Health Organization's envenoming strategy for prevention and control, which aims to halve the number of snakebite deaths and disabilities by 2030, empower and engage communities, strengthen health systems, and increase partnerships. On 18th August, we submitted the report of our project to the State Minister of Orissa, and we have identified 4 actionable recommendations. For example, pilot CAN, pilot a snakebite forecasting system, pilot a database for avoidable disaster deaths, and raise public awareness. Thank you very much.